The Oshkosh Seniors Center presents Senior Savvy.
Hi, welcome to Senior Savvy. I'm Jane Wells, your host for today's show. Senior Savvy is brought to you by the Oshkosh Senior Center, where it's our mission to enrich the quality of lives for adults ages 50 and older. And today's show's topic is something that we as women all need to be concerned about, but just people in general, and it's breast cancer and breast cancer awareness. And I have two guests with me today. I have Beth McCauley, who is a certified mammographer. Did I get that correctly? And Kathleen Wagner, who's going to share a little bit about her story. So thank you, ladies, so much for coming on today. I really appreciate it.
You're welcome.
So why don't we start out, just tell us a little bit about yourself, kind of the personal stuff. We always like to get the scoop on people. So
I was born and raised in Appleton. And I'm married and have a family. Mm-hmm. I took my radiology training at Mercy Medical Center in Oshkosh, graduated from there in about 1980, and then my first job was at Kaukauna Community Hospital, which is no longer, actually.
Yes, exactly.
Mm-hmm. And then I returned to Mercy, worked there for 21 years, till I took a job with Theta Care Physicians in 2002. I've been doing mammograms for 24 years.
Wow. Now, I think you left out a little other part of your life that somebody told me that you once did. Any specific cheerleading activities that you were involved in?
Well, after I graduated radiology school, yes, I tried out for the NFL Packer cheerleading squad, and I cheered with our team for a couple years. So
really neat. And
yes.
You are Beth, of course,
yes.
Because I introduced both of you, but so that people know who is who here.
Okay.
So,
yes.
Great. Well, thank you. And Kathleen?
Yeah, my name is Kathy Wagner. I'm an Oshkosh native, born and raised here, graduated from Oshkosh North and also UW Oshkosh. I'm a registered nurse, work at Aurora Medical Center here for almost 10 years. I'm married, I have 3 kids, ages 14, 13, and 11.
Okay.
Yeah, so kind of busy in between working and that,
Yes.
So
well, wonderful. Well,
thanks.
Of course, the topic that we're here to talk about is breast cancer awareness. So, and what we really want to do is get the message out to women about how important checkups are, and if you kind of have an inkling or a hunch or a nudge or something to follow up with that, right? So, Beth, tell us a little bit about what you see. I mean, how prevalent is breast cancer? Is it widespread? Is it isolated?
Well, 1 out of every 8 people will have breast cancer. Every woman, mm-hmm. 1 out of 8 will have breast cancer in their lifetime. That's what the statistics are. And it's not just the people who have a family history of breast cancer.
Okay.
Actually, the statistics also show that 85% of people that do not have a family history will also
so that whole, gee, my mom doesn't have it, or no female in my family ever had it, so I don't need to worry about checking on stuff is thrown out the window,
yeah.
isn't it?
Absolutely wrong.
It really
yes.
is. Wow.
And that's my case. There's no family history whatsoever. And I believed, I'm healthy, I'm
mm-hmm.
busy, I feel
You're a
great.
nurse, my goodness.
Yes, and
right.
So it was a real shock, a definite shock. So,
mm-hmm. And was there something that led you to go have,
I
or was just your routine?
It was
mammogram?
just, I admit I had skipped a couple of years, went in for a physical, and my nurse practitioner said, well, you better, you've missed a couple, it's time to go get a mammogram. So
mm-hmm.
Luckily I followed through on that suggestion and made the appointment, went and saw Beth, and the rest is history.
As they say. Sure.
Sure.
And Beth, in your type of line, I mean, what kind of difference can a mammogram make in the outcome?
Well, the earlier that you find it, the better the chances
mm-hmm.
are of survival. And the mammogram actually picks up small enough cancers that are too small to feel. Mm-hmm. So another thing that I tell people, though, too, is you need to be in tune with your body. Mm-hmm. And anytime you feel or see a difference in the appearance or texture of your breasts, then you need to follow up with your physician.
Right. And how many times do we just dismiss just different things, whether it's a cough or an itch or something that looks a little odd? Whatever, I'll get around to that, or something. So you had said that you had missed about 2 years with your mammograms and things like that. And so then when you went in, is it possible to tell how long the cancer had been developing, or can you not really tell that?
Well, I couldn't even feel the lump at all.
Okay,
and
so
the surgeon that took that did my lumpectomy said that it had been present for several years. So, I really have no idea how long it had been there. So, but
I'm glad she came in to see me, though.
Yeah, and I kind of had a feeling too when with the mammogram, because Beth said, "I'm just take a couple extra views of this because the doctors are going to want that." And
so let's talk about that a little bit, because you and I kind of talked about that, and
And now that's not always the case, though. Whenever someone wants to take a few more,
right?
Because if there's a young person has dense breasts or glandular breasts, you want to get that tissue in 2 views. So, and that's basically, I was including all of that. That's really the reason why I was doing that for you. And because it'd been so long, her last mammogram was on regular analog film, which is the x-rays that you can handle. They're all digital now, which really is a nice thing.
So let's kind of just go through the process. So if I decide, okay, I probably should get in for one, I call and I schedule an appointment. And then what happens when I show up for that appointment, typically?
I will come and get you, bring you into the room. You'll undress from the waist up. I'll leave the room, of course, but I ask you not to wear any deodorant, perfume, lotion, because those things may show up on the mammogram. So we just ask you not to wear any. And then the x-ray is taken by putting the breast in between 2 plates, and the compression may get a little uncomfortable, but it only lasts for a few seconds. I try to be quick. And the compression is very important, though, because you're trying to see things, in your case, in a very dense atmosphere. The way I always explain it to my patients is when you're fibrous and you're glandular, it's like looking for a plane on a cloudy day. And if you have fatty breasts, the plane is very easy to see. But so the compression is very important for those dense breasts so that you can tell what's going on in there. We don't want anything hiding.
Right.
So.
And so then again, if you say, or if the person who's getting the mammogram, they say, I want to take a few more views, that doesn't mean that they saw something necessarily. It could just mean that they need a different angle or a better angle, or there's more tissue there or whatever than the next person.
I try to explain that when at the time of the time of the exam, but sometimes when things go a little differently, then it makes you wonder if that's why I didn't do it that way. But
So how long does it take, the whole from the time you check in till you're walking out the door, dressed, heading back out, typically?
Well, probably about a half an hour.
Okay, so we're not talking a huge time commitment here, and people can do it on their lunch hour or right after work, or even possibly before work. So it's not something that's huge to try and fit in a schedule in terms of the reason why people might choose not to do it. I don't have time.
Right.
That's kind of not a really valid reason, right? So about how many mammograms do you do in a week, would you say?
Around 28.
Okay.
I work 3 days a week. So I'm there Monday, Wednesday, Friday, and I squeeze all those people in.
Too funny. So at what age should a person start getting mammograms, and what age can you stop?
Well, from my own, I'm talking about my own personal experience here now. In the last couple of years, I've seen an increase in the age group, the 40 to 50-year-old age group. And for that reason...
Increase in cancer or increase in those people coming in?
No, an increase in the cancers.
Okay.
So our radiologists actually recommend for that age group every year.
Okay.
So...
Which in the past, I think, it used to
It was
kind of
every
be,
other.
Okay, and wait till you're 50 or whatever. And maybe
So,
not.
and then after 50, you were supposed to come in every year. But
Okay.
yeah, they recommend every year.
So even starting at age 40
Correct.
to start to come in every year.
Yes. But again, if you are suspicious or anything looks or feels differently, you certainly need to tell that to your doctor so you
Right.
can get in sooner than that.
Right. But Kathleen, in your circumstance, nothing felt weird, right?
No.
Nothing.
No, I didn't
Just
notice.
somebody said, "Hey, it's probably
Right,
time,"
it's
and
time,
that's
and
right.
yeah, and so I made the appointment and was called back within a day or two that
Okay.
they wanted to do an ultrasound of the breast, and I went up to Theta Clark to have that done, and right from there, the radiologist came right in and just said that he wanted to do a biopsy, and it was my lucky day because he could do it right away for me. So had a biopsy right away,
Sure.
and from there, within the next, that was like on a Thursday, and I had to wait till like Friday or then following Monday to find out. So it was a long weekend, but yeah, it came back cancerous.
So at what point, especially being in the health profession, did you kind of go, wait a minute, you know, when you were called back or?
Yes, yeah.
Okay.
Well, yeah, and just with the extra views from Beth, I just, you know, I was just worried from that point on, and I remember even telling my mom, saying, oh, she took a bunch of extra pictures on that side, and my mom said too, oh, she was probably just getting, you know,
Sure.
more views or whatever.
Right,
So,
right.
and my sister even works with Ann. She's also mammography, and so she was
Okay.
kind of hollered at me a little bit, saying, you should have gone this, you know.
Coulda, shoulda, and
Yeah,
woulda, right?
yeah, right.
So I can't imagine. So you're in there, and you know, you're a little heightened because you've been called back,
Right.
and then to have them come in and say, all right,
Yeah.
we need to do a
I started
biopsy.
to
What are you
cry.
doing right
Yeah.
now?
Yeah, I mean, it was just, you know, right, you know, I was devastated. I started to cry right then,
Well,
and you know,
sure.
they're just like, oh, you know, it'll be okay. This will just give us a definite idea of what's going on. And so they went ahead and did that, and then, you know.
And so with the biopsy, were you under anesthesia or?
No, well, they can. It can be done under anesthesia,
Okay.
but he just really numbed up the area with some local anesthetic, and just you know, I was able to tolerate everything, and it went fine. So.
Okay. Support-wise, from the time that they took the biopsy until you found out, I can't imagine how that weekend went. You know,
It was
what
a
do you
very
do
long
with your
weekend.
time?
Right, and just waiting, and you know, just waiting and wondering, and you know, tried to keep busy, and
Sure.
and so, but yeah, it was a long weekend, and then but it was almost a relief just knowing,
Right,
you know,
right, to have
because
an
that being
answer.
in the land of not knowing versus knowing was
Right.
hard.
Right. And did you share with your family?
I did. I
Okay.
shared with my mom and my dad for sure, and of course my husband.
Right,
yeah.
right, yes.
Yeah,
Right.
but yeah, yeah. And then once we knew for sure, you know, just you know, going to see the surgeon. You know, my mom and my sister and my husband came, and you know,
Sure.
so I'm really lucky in that respect. I have a lot of support from family and friends, and you know.
So after the biopsy came back positive, what happens then?
Well, then
so
I
that
got-
was on a Monday that you got a call.
Right.
And
And then they asked if I had, you know, if I had a surgeon that I had in mind that I would like to go see. Otherwise, well, they had one,
Right.
but you know, just
Sure, yeah.
asking if I had one, and I did, and they put the referral in, and that surgeon called like within the next day, and had an
Okay.
appointment set up to go see her, and from there, you know. It was just comforting because she had a definite plan, and she had my films and everything. Was able to show my family everything, what exactly was going on, and
Usually
No.
goes pretty fast
Right.
after that.
well, it really sounds like it. It sounds like once you
Right.
got the diagnosis,
Right.
that next thing. So the diagnosis was on a Monday.
Yep.
And then when were you in surgery?
Well, she could have done it like that following Tuesday, but
Okay.
that was right around Easter, and we had this big family vacation plan, and
Sure.
so she said if I do it that week, you won't be able to go, you know, do much. So we
Sure.
just did it the week after, so which worked out well. And then it was just a day surgery. It was kind of a long day, but it was that, and then just waiting for the pathology to come back, and then for the follow up, and she had that all set, and then you get introduced to the oncologist and the radiation oncologist, and so it was just
Right. And so, I mean, you're in the medical field, and yet for somebody who's not in it at all, you know, all those terms and the different specialists that you need to see, is there support in place to help people through that process
sure,
at all?
definitely,
Okay.
yeah. I know at Aurora there's a breast care coordinator,
Okay.
and who kind of is there right from the time you're diagnosed, can walk you through all the different, and accompanies you to appointments and everything. And I know several hospitals around the area have that also. They can kind of handhold, and then once you get into the chemotherapy, there's social workers there, and just, you know, if you need anything, just let them know, and everyone bends over backwards.
Well, some of the decisions you have to make, I mean, you really have to educate yourself in a very short time period to figure out what's best for you and what feels right for you and things like that.
Well, it's just a lot of information to absorb too. You know, just even, you know, working in that is just a lot. And it's like, I'm glad I had someone with me that could actually take notes, and then those notes were helpful just to go back and rethink everything. And you know, it's like, you know, just asking, what did she say again?
And
then,
what did that mean? Exactly,
Right.
exactly.
Right.
Well, you have a calendar in front of you. Beth, you want to tell us a little bit about this calendar? And we have a few shots of some of the people that are featured in the calendar. And what's this all about?
This was a benefit for breast cancer. And actually one of our mammography technologists at Theta Clark is Miss November. So, but this is all people that have been diagnosed with breast cancer, their stories. So it's just to support breast cancer.
Right.
And it's a beautiful calendar. And all the proceeds go to the Breast Cancer Fund.
And what's so neat about that is, I mean, it does share the story of the person that's featured for that month or whatever. And one thing you see as you go through that, it doesn't hit a particular age group, does it?
No.
The women featured in here are from all age groups. And so we were talking about at what age do you start getting a mammogram? At what age do you stop?
My answer to that is when you get to be the age, or when you get to a point in your life where if you would find out you had cancer and you wouldn't do anything about it, then that would be the time you could say, I'm going to stop.
Right. Okay.
And that brings me to the next point, though, is there's always the thought of, do I really need to come back for those additional views? So it's a very important thing.
Are they just trying to scam me and get more money out of me, or what? You know.
But if you have that particular type of mammogram that they want you to come back, that report is not complete until you come back for those additional views. And they cannot diagnose what's going on with you until that exam is complete.
Right.
So.
And how are you with that? How do you handle? You were sharing a story about just how you get after those people, don't you?
We always send a letter, and then if I don't hear back, then I send a certified letter. If I don't hear back, then I tattle on them with the doctor. And then the doctor goes after them. But there are some people that just elect not to come back, but that's a very important part of this.
Well, I can imagine the fear is huge, and some people maybe would rather not know than to know for sure. You know what I mean? And that certainly doesn't excuse it, but I think we all have a responsibility for our own health's sake that, you know, if you get the call to come on back, we just need to take another view, that you follow through with it and do it.
Yeah. And another thing, too, with the additional views, I think some people are under the impression it's a repeat of what you've already had done. And that's not the case. It's because something looks like it's changed, or if something new shows up on your mammogram, then the radiologist will want more views of that particular thing.
Sure.
So it's not a repeat of the exam that you just had.
And is it typical to see changes like from 5 years, like if I looked at mine from 5 years ago to today, just from aging or whatever? Or?
There can be. Usually as you get older and your hormones go down, the breasts become more fatty tissue instead of the glandular.
Okay.
So you become more of the blue sky instead of the cloudy day. So.
Oh, funny. All right, so if I get the all clear, how often you said if you're over age 50?
Once a year.
Once a year, to still come in once a year to be checked.
Yep.
Because things can develop in that year's time.
And make sure that you check yourself, though. And if anything feels or looks different, contact your doctor.
Okay, good things to know. Let's see. Any other things you'd like to share at all about the whole process and where you're at today?
Well, I just finished up my last radiation treatment last week.
Okay.
And so I'm done with all the therapies. I'm going to be taking tamoxifen for the next several years. So yay.
So tell me about that, tamoxifen.
It actually, my breast cancer was fed by estrogen. And the tamoxifen will block the estrogen. Which should help to decrease the chance of reoccurrence.
Mm-hmm. And did you have chemotherapy as well as radiation?
Yes, I did. I had 4 chemotherapy treatments.
Is that typical to combine the two?
It all right.
Okay.
Depending on the staging and that kind of thing. So, but yeah, I had the 4 chemotherapy treatments and then 33 radiation treatments. So.
Wow. And what does the radiation treatment involve?
Well, it involves a commitment to go there every day, Monday through Friday.
Okay.
And it just, that's a big thing. The commitment to get there and to really give yourself good skincare in the area, so you don't have any breakdown, and just kind of allow yourself to be kind of put into positions you wouldn't normally do, so they can get the beam to the right area.
Sure.
So.
And did you continue working through this?
I did.
You did. Okay.
Yeah, it was a good therapy for me, I think, just to stay busy and that. So
overall, how did you feel physically?
I always thought I felt good, but now that I'm done with everything, I'm feeling so much better. So I guess, exactly. Tired and
Well, thank you so much for being willing to come on and share
you're
your
very
story
welcome.
a little bit.
You're very welcome.
Very
Thank
cool.
you, Beth.
Exactly. Well, and Beth, I mean, what you do, your work is so critical. Because I imagine you're dealing with a lot of emotions right then and there in that moment. And how do you relay information without really relaying, fear and everything else, and yet a seriousness that, hey, you know what, you need to maybe come back, or let me just get another angle without, there's a lot of things that you're holding together in that moment, aren't there?
Yes, and I feel one of my goals as the mammographer is to make somebody feel comfortable with the exam that is a little embarrassing and uncomfortable, and some are, it's scary to some people, and so I try to make it the best experience as possible.
Right.
So
very neat. And so for women who are watching, what's our key message to them?
it takes a lot less time to go have your mammogram than to go for treatments.
Yeah.
Exactly. Get your mammogram.
Yeah, exactly. And again, ladies, thank you so much for both coming on. I really appreciate it, and for sharing the message. So everybody needs to call their doctor's office, right, and make their appointment and get in. Exactly.
Have your mammogram.
Wonderful.
Definitely.
All right. Well, next we're going to talk a little bit about an event that's coming up at the Oshkosh Seniors Center, and I had a chance to speak with Jeff Lethan, who is the president of the Friends of the Oshkosh Seniors Center Board, and they have a little fundraiser coming up in November, and so he and I sat down and had a chance to chat about it. So I'm going to share that video with you now. So Jeff, if it's a November night, not knowing what to do with myself, you got anything?
Absolutely, we do. Actually, we're the Friends of the Oshkosh Senior Center is sponsoring our first annual spaghetti dinner, and that's going to be the first Saturday, which is November 2nd.
Saturday, November 2nd.
So keep that in mind.
Save the date. Save the date.
It's going to run from 4:30 until 7, so it's just come whenever.
Okay. So obviously, people who come at 4:30 aren't still going to be there at 7, sitting at the table eating. So you're going to come in, you're going to eat, and then you're going to move on and enjoy some other things, right?
Correct.
Great. So it's going to be at the Oshkosh Senior Center.
Correct, at the north facility.
Okay, so that's the one where they work out and have the fitness equipment.
Yes.
We're going to get all that workout stuff out of the way, and
They
we're
can
going to
have
have some
spaghetti
eating.
dinner and have a workout.
Exactly. And cost to come and eat?
For adults, it's going to be $8. For
Okay.
children, age 12, it's going to be $5, and then children under 3 are free.
On Saturday, November 2nd, at the Oshkosh Senior Center. So just noodles, or is there a little bit more to it than that?
A couple things. We're going to have spaghetti with meat sauce and without meat sauce.
Okay.
A salad, some breadsticks, and a dessert.
Oh my gosh, all that for $8?
Yeah. Plus Coffee, coffee, milk, and we'll probably have soda and water for sale.
Okay.
Separate if people want that.
Wonderful. So Jeff, if this is something I'm interested in doing, do I buy tickets ahead of time? Where are they available? That type of stuff.
You can stop in at either one of the facilities at the Oshkosh Senior Center and purchase them at the desk.
Okay.
We'll have
Yep.
them, or we can also purchase them at the door.
Okay. So if that night all of a sudden I don't feel like cooking and I've got a whole group with me, we can just show up at...
Absolutely. Just
Right.
show up between 4:30 and 7. And one of the things, this is to benefit the senior center, but
Yes.
it's also a family targeted. So we're looking for families to come, maybe with grandparents, either or if families just want to come, we welcome anyone here.
Okay. So if my little Joey isn't quite sitting in the seat the whole time, that's not going to be a problem, right? It's
not a
more of a
problem.
casual atmosphere
Absolutely.
and that kind of stuff. So again, tickets would be available both at the north or the south building. And we're going to have spaghetti and a salad and bread
Dessert.
and dessert and
Coffee,
my goodness,
milk,
that's neat. Lots of stuff. Well, it sounds like a really fun thing to be a part of.
It is. It's a good social event for families to get together or for seniors to come in and get together. And the whole thing is to help raise money for the senior center. And that's our purpose, being the
Right.
Friends of the Senior Center. 100% of the proceeds always go back to the center for its operations.
We are so lucky to have the Friends of the Oshkosh Senior Center. We really are.
And the board and every member that's on it is very passionate about supporting the center. So it's a great organization.
And you and I aren't quite old enough to actually come to the center. Oh, wait. You are.
I am.
Oh, wait. I am too. Oh, well. Here's to you, Jeff. Hope you have a great event.
Thank you.
Thanks. Well, it was fun sitting down and chatting with Jeff about the spaghetti dinner in November, but there's also many other things that are happening at the Oshkosh Senior Center, and I want to take just a couple of minutes to talk to you about them. So here we go. Here's what's all coming up at Oshkosh Senior Center. So health and wellness. It is that time of year where we need to think about getting our flu shots, and we do have flu clinics offered at the Oshkosh Senior Center by the Visiting Nurses Association. So on Wednesdays in October, the 2nd, the 9th, the 16th, and the 23rd from 9 a.m. until 12 p.m. No appointments are necessary, so you can just stop on by and come on in and get that flu shot that you might need. Medicare Part B and most Medicare Advantage plans will cover the cost of the vaccines. So don't delay in doing that. Get your flu shot. We have some educational programs coming up as well. Managing Money in Retirement. Friday, October 18th at 10 a.m. And this is sponsored by the Valley Visiting Nurses Association and the Lutheran Homes of Oshkosh. And it is presented by Providence Financial. We ask that you do call ahead of time. Please call and register by Tuesday, October 15th. And you can call 232-5300, which is our main line, and just tell them that you want to register for Managing Money in Retirement. We have educational programs coming up, and this one is probably of great importance to you. This is sponsored by the AAUW, and it is the Patient Protection and Affordable Care Act. And since that seems a little bit hard for people to kind of grasp, this is going to be on Tuesday, October 22nd at 7 p.m. And this is again at the Oshkosh Senior Center in the South Building. And this is for individuals and families age 64 and younger. There's going to be new health insurance choices and all of that. And so come on in and learn a little bit more about the Affordable Care Act and what that means for you and your family. Also, along the lines of education, we have Planned Giving, October 24th at 10 o'clock a.m., and this is presented by the Oshkosh Area Community Foundation. Think about the legacy that you want to leave, and what does it mean to provide for your family but still have other things for your community as well. So you can learn all about that at that educational program. And this is one I'm really looking forward to. It's our Halloween dance, Friday, October 25th from 1 to 3 in the North Building. Cost is $3 per person. This is a friend-to-friend program, so come on down. You can come in costume. You don't have to come in costume. We're going to have a great time. We're busy planning that and really looking forward to that. And then lastly, we have our friend-to-friend dinner and concert night, Saturday, November 2nd. And you might go, isn't that the same night as the spaghetti dinner? Yes, it is, because you're going to meet at the North Building for the spaghetti dinner at 5:15. And then afterward, you're going to travel over to Oshkosh West High School to hear the Oshkosh Area Community Band. And that concert is free, and of course the spaghetti dinner was $8 for an adult.